We are back with Dr. Deborah Grant joining us to talk about COVID-19 and improving trends and what that means for fighting the pandemic. So we're going to our text questions now. The first question is, what is the Delta variant? Can you explain that to us?
Yes, as the COVID virus continues to change over time, and one of those different types now is called the Delta variant, coming from the UK and from foreign countries into our country. And it's about 8% or above now. Some places
now I can.
10%, especially out in the western United States. So as people travel and they bring back COVID exposures to our country, then that continues to change. And so even within our country. But the good thing is the vaccine is still used for that too. And it's showing about a 90% effectiveness. So that's been very positive, even for the Delta, just various types of COVID as it changes a little bit. But it's still being shown to be very effective, which takes both doses. Unless you're doing a Johnson & Johnson. I think that several of the studies said only about 34% effective if you only get one shot. So let's go for both. Let's get them both done so we can all get back to a more normal life.
All right, so this person is asking, will it become a dominant variant? And if so, what can we expect? And can we expect that our vaccination will be okay with this?
Yeah, as I was saying, it is looking like all the studies that our current vaccine does impact this Delta variant as well. The difference with this one, it seems to spread much faster, it affects the younger, and it also is causing even more hospitalizations. So let's get the vaccines, and it still will impact it and keep it from spreading here. It has spread and become a predominant one, especially like in Australia and different countries. And so I think it's all of us doing our part. Our part is helping to get the vaccine right now.
All right, so this person is asking, could you tell me if and when a COVID booster vaccine will be given?
We have not found that out yet because the studies are on those people who got the vaccine and the test, and it's continuing to show that it's being effective. So the longer we're going, those same people are being watched to see, do we need a booster? And at this point, we have not found that we need that yet. So they will continue the studies to look and see if we need one. And at this point, the answer is still no.
All right, and this is kind of a follow-up question to that. This person says, if I had the J&J vaccine, which was the one-shot vaccine, and we do in fact need to have a booster, can I take the Pfizer vaccine as a booster?
What we have learned so far is it's good to keep the same vaccine. And so that may be what they find when the boosters come out. We haven't, again, gotten our guidelines for that. So we don't know for sure, Tanya, but I think we'll be looking for that. And if that's the case, we'll let you know which one those Pfizer or Moderna if you don't want to take the Johnson & Johnson again. And that's a question that we've had some people ask. So we'll be looking for that guidance.
Okay. And then this person says, have they released a vaccine for 5 and under? And if not, when do we think that might become available?
It is still in studies, and so we don't know exactly when that will be coming above. Right now we don't even have the 5 to 12. So right now it's 12 and above, not 5 to 12. So we think first group that will be the next group will be the 5 to 12, and then after that, younger than 5.
So this next question is, one that we haven't had in a while. Where can you go get tested for COVID?
So you can still go to our Green Valley campus. That's on the Green Valley Avenue and get tested. We still have a team there on Mondays and Wednesdays. You can also go to many of the local community CVS, Walgreens, different places. So just go online, and they've got places where you can get tested in our community right now.
So this person says, my husband got the Moderna shot a couple of months ago. And then she says, where can I go to get the Moderna shot? I don't know that all testing places tell you exactly which shot you're getting or if you're just getting 1 or 2.
Yeah, sometimes they don't. But if you call our number, that 336-890-1188, we can tell you if you want to have the Moderna. Most of the time, our mobile teams are doing Moderna, and then our fixed site at the Coliseum is doing Pfizer. But if you go online, it will have the location, and then it also have the type of vaccine being given. But if you just want to know, call that number, and we will find one just for you.
All right, so this question is kind of like the booster question. It says, will we be vaccinated next year?
Yeah, who knows? That would be nice. There's been some studies saying, could we combine it with the normal flu vaccines? I think right now there's a lot of work going on to say, when do we need to get a booster? And then if it can be combined with another flu shot or can it be combined with a different vaccine. So I think there'll be more to come, but we really do not have the answer yet. Sorry, I wish we did.
Well, there's been so much of that as this last year and a half has gone by, where one answer is right now and you ask the same question in a week or even like 3 weeks and the answer is very much different because of the science that we find out about.
Right, and I think that's been so nice, is that we really are continuing to progress. We're not stopping with this. We're saying what is the best, and anytime there's reactions, we stop and say, hold on, let's make sure we know everything, and then we move forward because it's new and we're building the science together. But now it has been around long enough, from the vaccine side to know that it really does work.
All right, we've got one more segment for you so that you can ask your text questions. The number right there at the bottom of your screen, 336-379-5775. We'll be right back with Dr. Grant.